We invest everything that we make back into this community. We're named after the ultimate Good Samaritan in Louisville, and John N. Norton and his wife Mary Louise Sutton Norton. And we're very proud of that name. We're very proud to continue the legacy of being a Good Samaritan, to give everything that we have during every day in service to the community.
There's so many things that make Norton Healthcare unique and special to this community and to the region. If I think back to our history, founded in the late 1800s, really out of the generosity of the community at that time. And we've grown so much since then to now a hospital system that serves the entire region and responds to the needs of our community really wherever they are.
My family has been involved with Norton Healthcare for about 4 decades, and we're thrilled to be involved and give back to the community, especially to Norton Healthcare. My mother was diagnosed with ovarian cancer about 25 years ago or a little more, and unfortunately died in 2000. Had a great experience in Norton, but there were no Norton Cancer Institutes or research projects. And I often think if she were diagnosed today, how much better and longer her life would be had she had all the tools that they have now.
I think we've demonstrated areas where we've had real intentionality and we've moved programming. If you think about our Norton Cancer Institute or the Novak Diabetes Care Center, when we can leverage resources with the system's resources, with support from the private community, we can really move in the rankings.
It's a great example of how when people can come together and how donors can come together, we can work together so that we have the best state-of-the-art equipment, the best state-of-the-art treatments, the state-of-the-art providers, and get the best possible results.
We want to be home to world class. We want to be home to best in nation. I want to be able to turn to the Norton Cancer Institute or the Neuroscience Institute when my family needs it. This work is not necessarily all about a building, and it's not all about a program. Workforce is so important. And for us to be able to go out and attract and recruit the best and the brightest to come to our hometown. So we have to put ourselves out there as a differentiator. If we can fund a fellowship or we can create an endowed chair, those are the types of things that make a difference. That's what's going to help us attract the best and the brightest and help bring them to our community so that we can build great programs around a team of people. Norton Healthcare really has put a flag in the ground, if you will, around the whole issue of health equity and trying to expand our reach to ensure that everyone in our community has access to primary care, moving into new parts of our community and new parts of our region, building on our strong foundation of our mobile prevention units and our outreach work. Our Board of Trustees and our leadership has said, we know we can do better and we will. And part of our vision for the future involves this, in serving the LGBTQ population and serving the Hispanic Latino population or the African American population, and making sure that we have providers that reflect our community and that we're here to provide services and to provide care to our community, regardless of where they come from or who they are.
We've always believed that healthcare is a right. It's not a privilege. It's something that we think can make lives better and something that we believe everyone should have a right to have access to. We're now building the first hospital that's been built west of 9th Street in over 150 years. So in many ways, we define health equity as providing equal access, equal opportunity to access the services that individuals need in order to live a better life.
I know from personal experience or from family member being ill that it's difficult going through the health journey. I just realized that giving is so much fun when you see the good that it gives to people and hopefully make the care a little bit better and a little bit easier to get through.
If you think about quality of life in a community, and you think about your parents and your grandparents and wanting them to live the most vibrant, healthy life that they can and being their absolute best people, there's so much that Norton does to support that. We work with so many people with chronic illness to help them live full and vibrant lives. That's what makes our community great. That's what really separates a good community from a great community, is having really healthy, vibrant people that live into their golden ages. And we all want that. We want that for our parents and our grandparents. And I think that's what an investment in Norton Healthcare does.
Our community has great potential. There's no doubt about that. But in order for us to achieve that potential, we're all going to have to be part of this. It's going to take us all together, and we are going to have to imagine things that we've never imagined before. Imagine the success that we'll feel. Imagine the difference that it'll make for individual lives in our community. But just imagine how important that is to our future.